hello. We have Caleb here. Caleb, tell me what you're doing. What are you doing right now?
Going up.
You're going up? All right, Caleb, how old are you today?
4.
You're 4. Okay. Anyway, I saw Caleb since he was a couple months ago. This is early May. I saw him and his sister in January. And both, and we didn't talk about his sister, both have had difficulty seeing in 3D. They did have a screener at the Blanchard Valley Pediatrics that actually found out that they both had difficulty with seeing in 3D, 3 dimensions. We have an E and we have a blank. And this is called a random dot stereogram, that you're going to see this E if you have stereopsis and you're wearing the Polaroid glasses. So we're going to put the Polaroid glasses right over top of your glasses. And I'm going to mix these around because you don't know which one's which. Here we go. Can you find where the E is? If you want to hold it a little closer, nope, that is the blank. We'll try it again. Can you find the E now? You can hold that a little closer. Can you find the E? That's it. Do you see it or did you guess? Okay, so people wonder about why is depth perception important for kids, for adults. Depth perception is very important because eventually Caleb will be driving a car. And when you drive the car out in the world and you stop at a stop sign and you turn to look to your left, you turn to look to your right, and you're trying to figure out where is the oncoming traffic on my left, on the right? What is the space? What is the distance between my vehicle and the oncoming traffic? And there are a lot of people that do not see in 3D, do not see in depth. And that's one area where one might have some difficulty. The other area might be playing sports. I know a particular family member who has difficulty seeing in 3D. And even though he is not challenged vertically, he'll bump his head on an open doorway, but his depth perception is not, he doesn't have the discernment of seeing in 3D. So when he's younger and playing basketball, he had a lot of difficulty catching and throwing the balls to his teammates. And when you have no depth perception, your world looks like a postcard. You don't see the space between the individual me and my teammate or my opponent. And so if you don't have depth perception, that can be a big challenge. And we're going to show later on some things that can be done to help stimulate depth perception. So you might notice with Caleb, and you might have seen a little bit with Claire, that Caleb has an overturning of his right eye. He's been doing a lot better since he has glasses, the +2 spheres right and left. So here we go, Caleb. I'd like you to, did you see the picture when your sister was sitting in the chair?
Yeah.
How we talked about what's the best way to sit. Should you sit like this? Should you sit like this? You should sit straight and tall. All right, so let's try that. Let's sit uncomfortably straight and tall. How many eyeballs do you have?
2.
2. You need to do everything you can to keep your eyeballs horizontal. I'm going to put this up here because do you lean on one hand sometimes when you do your schoolwork? Do you push one eyelid closed? Do you push your eyes closed sometimes? Some kids will do that. Some adults will do that because they push the eye closed because they don't want to see double. It's easier to push the eyelids closed than to physically close it. easier to have a patch on rather than to physically close. But our goal is to try to help the individual who has two eyes to see one and to have normal pursuits, normal tracking, normal saccades, jump eye movements, and normal convergence. So here we go. And you can see that Caleb's right eye is overshooting. This is called a convergence excess. It can be called an esotropia if it does that all the time. And you might be able to see that as Caleb is moving his eyes back and forth, you might see a little jerkiness. Again, that's a pursuit eye movement disorder, a tracking disorder, and we want to help maximize his pursuits. We want to help maximize his saccades, jump eye movements, and help him to have normal convergence, because when this eye overshoots inward, then he's going to be either seeing two. How many do you see right now? Or,
One.
okay, so if he only sees one at the moment, it's because he is suppressing the right eye. He's turning off the right eye. So what we wanted to do was to demonstrate a couple things here with Caleb and his sister Claire. Claire, you're not maybe seeing her right eye had turned in as much as Caleb's is right now. Follow it, follow it. There we go. And again, you see that this is what happens sometimes in the classroom when kids are performing. They might not like to look at two. They might not like to read because they're seeing two. They see blurry. They see smeary. Vision is the least understood physiological function of the human body, even in the 21st century. There was this fellow a couple years ago that wanted to get into West Point Army Military Academy, and the guy actually cheated a couple years ago. He had a lazy eye, and he looked through the crack to see with his better seeing eye to pass the eye test. The screener didn't notice that he was cheating, but the guy actually cheated. He got into West Point Military Academy, Army, and graduated number 21 out of 39. And then the fellow became a general for the North and one of our presidents. Ulysses Grant cheated looking and passing the same eye test in 1839 that our school nurses have the same vision screening in our schools today. Our vision screening hasn't progressed since even before 1839. They changed the letters around a lot of times, but they have the same standard test. Right eye only at distance, left eye only at distance, then check hearing. And rarely does do the screeners look to see if both eyes are pointing in the same place. Again, it's assumed that everybody sees one, and most professionals don't look. All right, so what we're going to be doing next is to go to the vision therapy room. And thank you very much, Caleb.